Hey everybody, Davey here. I wanted to make a quick little video, kind of a PSA or a public service announcement, a reminder, if you will, for those that don't know my story. Over the past year, 1 year ago today, I was in Lincoln, Nebraska, for work, and was at a hotel there. Got up that morning and got on the treadmill in the hotel gym, and a couple of minutes later, um, I had a massive heart attack, and I was found, uh, by the grace of God, by a lady named Shar, who I'll put a picture of Shar up here, who worked at the hotel, and just literally by the grace of God, just happened to come in the gym that morning, and she started CPR on me, and didn't stop for quite some time, even when others may have thought I was a lost cause. And eventually the paramedics got there, and they got me, and somewhere between the hotel and the hospital, they shocked me 6 times, and the sixth time apparently my heart decided to kick back into a normal rhythm. Um, all that to say that this last year has been, on top of COVID and all the challenges that we've faced. It's been a little bit of turmoil with the recovery and the rehab and all that as well, and those things have been interrupted, and COVID made that more difficult. But thanks to a really great crew at Williamson Medical Center, Heather and Brandy, and the team there, did get through the rehab, and hey, now we're on the other side of that, and just trying to chug back along, get back into a routine here. But all that to say that I didn't have any warning signs, no pain, no symptoms that I noticed, numbness, tingling, chest pain, back pain, any of that. I thought I was doing the right things, eating right, exercising, and I was. I just a few months prior to the event, I'd run a 50K and other races and trail runs leading up to that. So I really didn't see it coming. Obviously, those that know me know there's some family history, there's some genetics, and that certainly plays a part in, these cardiac type events. But what could I have done? Well, I could have, at some point in the past few years, I could have gotten a calcium scan, coronary calcium scan, a heart scan. It's all the same thing, commonly just known as a calcium scan. And this is essentially an X-ray of your heart that they're able to do now. And what it does is it shows any calcium deposits that have built onto the plaque in your arteries. And to my understanding, the plaque itself does not show up on the scan, but the calcium that's attaching it to the arteries will. And so from that, they're able to see if there's a risk factor there that would warrant getting further diagnosis and further treatment. And the thing about the calcium scan is it's non-invasive, and it's pretty cheap. It's like $50 to $100, even without insurance. It's still pretty affordable. And if $50 to $100 is not affordable, then reach out to me, and we'll 100% make sure you can get a scan if you want to get a scan. Because once you have that scan and you've got that number, you want a low number. Like if you have no calcium, then it's a 0 score, and it can go up from there. But it gives you a window that you wouldn't otherwise have into knowing if there's some type of risk there that you don't see coming. And I think it's the kind of thing, from talking to my physician and cardiologist, that it's really just a matter of time before this is a common uh, thing that everybody's doing at certain intervals in their life, whether it's every 5 years or 10 years. And I mean, this thing just, it's like an x-ray. It just takes a few seconds, and you're in and out and done. And you can get it done at like any of the diagnostic places or that kind of thing. You don't have to, like, it's not a big hospital event or something. So that is my public service announcement. Please consider, even if you think you're doing everything the way you're supposed to be, to go get a calcium scan done. And it's not fail proof, but it's some really good technology that we've got here in the past few years to give us a little window into the heart, and just to give you some reassurance that everything is good, or hey, we need to look at something further. So male, female, doesn't matter. 30 years old, 40 years old, 50 years old. I think just about everyone would benefit from getting this scan done. I know a lot of my the people that I see and interact with on a daily basis, the guys I run with, girls I run with, have gone and gotten this done. And I would encourage anyone to check this out. So maybe this will be like an annual. On this day, we'll make it an annual reminder to if you've had a calcium scan done. So, all right, thank you.